Dr. Gabriela Ilie's talk, and then she's going to touch on some of the similar issues and bring it further forward and touch on the mental health aspects. And Dr. Ilie is a cognition and educational psychologist. She specializes in research that analyzes the processes through which music, she's particularly interested in music, affect perception and social perception and behavior. She's a psychologist. She's currently a postdoctoral fellow at St. Michael's Hospital in the Prevention Research Group. And she's been looking at the cognitive effects of traumatic brain injuries in various populations in Ontario. And she's particularly interested in these aspects about how brain injury can affect our affective and our perceptual abilities, cognition. She's particularly interested about aspects of developmental psychology in relation to traumatic brain injuries. So we're fortunate to have Gabriela with us as well, and she's going to tell us a little bit more about this interesting survey. Thank you.
Thank you, Michael. It's a pleasure to be here. Just before I begin, I just want to have a show of hands in terms of how many parents of children that are engaged in sports activities in Canterbury. Thank you. How many educators? Thank you. And medical professionals? Excellent. How many people are here simply because they have undergone a concussion themselves and they want to learn more about it? Excellent, thank you. So now I know what I should say that might be of somewhat interest to you in the talk. So I'm just following in the footsteps of Dr. Michael Simon and Dr. Mann from the Center for Addiction and Mental Health. I'm extremely fortunate to have had the opportunity to work with both of them. I praise highly because we should not take for granted big collaborations like this that involve 4 institutions. Imagine how many things had to happen for this collaboration to exist. So I think we're very, there's a great opportunity here for prevention, for education, from which we can all benefit. Okay, so I'm not going to tell you much about the auspices since Dr. Mann already walked you through the surveys and what's involved. I will say this, that indeed the survey studies that are conducted at the Center for Addiction and Mental Health are the longest in the world, in Canada. They're very thorough, and so in 2010, in addition to a variety of questions that they have with regards to substance use and mental health in the adolescence population, they added this question on traumatic brain injury. And as you pointed out a little earlier, the question as it is assessed taps more into more moderate to severe traumatic brain injuries, losing consciousness for at least 5 minutes, or being hospitalized at least 1 overnight because of symptoms associated with it. So underestimates, the numbers are big to begin with, and they're underestimates, not just because of the way traumatic brain injury was defined, but also because we looked at Catholic schools, we looked at public schools, so places such as specific institutions where delinquent adolescents end up were not included. So that also lowers the number of reports, the number of estimates. A paper published in JAMA showing a relationship, a substantial relationship between traumatic brain injuries, alcohol consumption, cannabis consumption, and lower grade performance. So the focus of my talk is going to be on mental health issues among adolescents grade 7 to grade 12. We're talking children here, age 10, age 20. I think that's important to keep in mind. Previous research has shown common reasons for medical referrals post-TBI symptoms among teens, but there was no population data to support those results. And indeed, we see, if you review the literature, you see in some smaller scale studies that some of the reasons for referral to medical doctors, post-concussion, post-TBI, traumatic brain injury, are internalizing factors such as attention disorders, attention ADHD, depression, anxiety, cognitive, emotional, and social impairments associated with injury, but also externalizing factors such as using alcohol, drugs to cope with the effects of the injury, sensations, risk taking, and contact problems. A previous smaller scale study showed that adolescents with TBI present antisocial behavior, have fewer reasons for which oftentimes parents and adolescents seek medical attention, and that has to do with, oh, thank you. Can you hear me now? Were you able to hear me before? Oh, good. Physical symptoms that are the reason for or propel someone to seek medical attention. Reasons that have to do with movement, balance, but also visual and auditory reasons such as irritation with lights, irritation with pitch, problems with sounds and so on. And while the smaller study shows that those problems persist well into adulthood, so we have smaller studies showing a clear relationship between mental health and traumatic brain injury in children and adolescents, but we don't have a larger study that could take a look to see whether this relationship still holds. And plenty of adult studies showing a relationship between traumatic brain injury and mental health. Some of the aspects of mental health that were included in the authors and that we examined have to do with elevated psychological distress. We used a scale called the GHQ that measures that. Suicide ideation, suicide attempts, being prescribed medication for anxiety, for depression or both, or calling the crisis line, teens, children, web-based crisis line. We also looked at antisocial behaviors, such as breaking entry, stealing more than $50, stealing a car without the owner's permission. We looked at violent behaviors, such as carrying a gun, or being threatened with a gun on school property. We looked at bullying, being bullied at school, through the internet. But we also looked at aggressive behavior, bullying others, and to see how that holds in, among students who have experienced a traumatic brain injury. These are some of the results that we see. Now what you're seeing here, those are the results of the authors in terms of elevated psychological distress in the past few weeks by sex. You see males and females. These numbers are about 30%, between 30 to 40%. Numbers have not changed since the first time this question was introduced back in 2000 actually 1999, the year 2000. And what we see is that, however, we do see a change, a trend change since 1999. More females are experiencing elevated psychological distress compared to males, so a slight change there. And what we see is, when we look at half of the sample that we reported in the journal paper, so only 4,735 students compared to 9,288 as we had in the full sample. So half of the sample was presented with those questions, and we see that students who have experienced or reported at least one traumatic brain injury in their lifetime are twice more likely to report elevated psychological distress, seek counseling through a crisis line, and almost 3 times more likely to be prescribed medication for anxiety, depression, or both, compared to students who have not reported at least one traumatic brain injury in their lifetime. These graphs present percentages reporting of students, grade 7 through 12, reporting suicide ideation and suicide attempts. So on the left, suicide ideation, on the right, suicide attempts. The percentage associated with suicide ideation in the 2011 sample that we looked at among grade 7s through grade 12s, it's about 10.3%. Again, that has not changed since the last time the survey was administered, and that would be in 2009. So 2009 to 2011, no changes there, about 10.3. High numbers among females compared to males. In terms of suicide attempt, attempting to sue, the actual act. So the ideation is when you contemplate the idea of suicide, right? Suicide attempt, about 2.83%. Again, no changes there since 2009. Higher numbers among females compared to males. And so we look to see what happens, and what's the relationship with students that report traumatic brain injuries in their lifetimes. And again, here we see that students who reported at least one traumatic brain injury in their lifetime had double the odds of reporting suicide ideation, and 3 times the odds of reporting attempting suicide compared to students who did not report lifetime traumatic brain injury. This graph here shows percentages reporting engaging in antisocial behaviors at least once in the past year by sex. And actually, that's important. We saw no regional differences for those mental health correlates I covered so far, and I'll be covering in my talk. No regional differences, meaning this problem is the same across the board. And the odds that I reported have been controlled for sex and grade. And that's also important, but they're not raw odds, but they're controlled for those apparent differences. Now, what we see here is, so blue is males, green is females, fire setting, high percentages for males compared to females, run away from home, higher percentages associated with females compared to males, vandalism, higher percentage or almost the same between males and females, theft worth $50 or less, higher for males compared to females, and so on. So again, antisocial behaviors don't seem to show a trend change since the first time those questions were introduced back in 1999. And our preliminary results show that students who have reported at least one traumatic brain injury in their lifetime have odds ranging from double to 3 times for running away from home, setting fire, stealing more than $50, selling cannabis, breaking entry, carrying a weapon, and assaulting someone with a weapon on school property, compared to students who reported no lifetime TBI. These are results concerning bullying, which is a subject of much interest to Canadians. Numbers in bullying have been increased in the children and adolescent populations over the years, and now we have bills that try to deal with the issue and contain it. And educators are working hard to prevent bullying in schools these days. So I'm sure the educators in the room will find those results interesting. So what you see here in the left side are results reported by the authors with regards to being bullied at school, where compared to being bullied through the internet. The results again haven't changed much in terms of bullying since 2009. However, cyberbullying has increased a bit, and it shows more bullying experienced by females compared to males over the internet. So 28.6 is the percentage associated with being bullied at school in the adolescent population in Ontario that we examined. 21.6 is the percentage associated with cyberbullying. And our results shows that students with TBI who have reported at least one traumatic brain injury in their lifetime and double the likelihood of being bullied at school or through the internet compared to students who have not reported a lifetime TBI. The percentage of all students reported in the most common way they were bullied at school by sex. Now, this trend again has not changed since 2009. Primarily, the bullying happens verbally, second category physically, third category theft, property damage, somebody stealing your, say, iPhone or something, or property that is of importance to you. Percentage of bullying others at schools. We're talking now about traumatic brain injured students who are engaging. They're not the victim anymore, they are the victimizers, they are the offenders. So here you see that 20.7% of all adolescents in Ontario have engaged in bullying others, and our results show that grade 7 through grade 12 show that students who reported at least one traumatic brain injury in their lifetime had double the odds of bullying others at school or through the internet compared to students who reported no lifetime traumatic brain injury. So what are the conclusions? Well, there is definitely a link between traumatic brain injury and mental health in the adolescent population, age 10 through 20. So this relationship that is found in smaller studies can be found in larger studies, such as the Oxford study examined. Again, a limitation of our study is that we do not know which comes first. Do those mental issues come first, and subsequently the TBI comes second, or is it the other way around? So that's something that we need to disentangle. One thing is certain. As parents and educators, we have a responsibility to keep our eyes on those issues. And as you mentioned, rightfully, not too long ago when you were talking, you said that sometimes students get a concussion. When is it important that we take the child to the hospital or to see a medical professional? And the answer is right away. Keep a log of all the symptoms. You see, a lot of those symptoms, one of the biggest problems with mental health issues is that concussion happened and then out of sight, out of mind. Because it's not a physical injury that has a cast around it, right? And then a little while after, a mental health issue develops, and what happens? We don't make the association, right? So you end up seeing a psychologist or a psychiatrist, and they have no idea that in fact there were one or more concussions history that have to be, seen together. So the cause is there, but it becomes invisible. Why? Because when you get a concussion, there is no cast most of the time. Right? Out of sight, out of mind. The importance of don't take the finger off the pulse of your child's psychological well-being, even when they're adolescents, because they're moody and there are mood changes and so on. We tend to think, well, that's kind of normal. They had a concussion, look, they're fine. They behave the way a normal adolescent would behave. Not necessarily. Keep a log of things. Our memory is not as good as it used to be. Keep a log of things. Make notes of things. Right? Notes over 2 weeks, a month and a half. Take them to a medical professional and they'll be able to help. And so, incredible opportunity for prevention with the study that we're doing in this collaboration. So what are the results overall? There are significant relationships between traumatic brain injury, substance use, and mental health issues. Males appear to be more likely than females to sustain a traumatic brain injury in the past 12 months. However, as we have looked at some gender differences, the issue of gender is much more complex. There's not much time to talk about it, but I would simply say that those results point out to traumatic brain injury among adolescents to be an urgent priority, research priority. Thank you. Questions of the rest? Yes. I think so.
Thank you. Just a quick question. I know you looked at differences between gender and age, but would it be helpful for the validity of the study if you did personality tests, like you pick 5 of these adolescents? Because I know on the graphs you showed that females are more likely to be stressed, and would that have to do because research says that they're more likely to be neurotic compared to males? Right? I wouldn't know, but would you think that would be helpful to do these personality tests before as a measure to increase validity of the study, to have a lot of different groups comparing them to whether or not, okay, this student is more open, extroverted, so that's why they would be doing a lot of risk-taking behaviors, or I don't know if my question makes sense.
Yeah, it does make sense. Of course, personality plays a big role in our behavior. Just as biological factors play a role, social factors, cognition, perception. Should we look at it? Yes, it's something that we might want to keep in mind for future surveys. Yes?
Hi, Dr. Gabriela. I have a few questions.
Yes, go ahead.
Do you have any interest in any specific aspects of perception that can lead to a diagnosis of traumatic brain injury based on which is experienced here?
Can you speak up? Perception, I heard the word perception.
Yes. Do you have any interest in any specific aspects of perception that can be affected following a diagnosis of traumatic brain injury?
That's something that is very important, of course. Perception of injury. It's a very important variable that we could look at, but not in this type of study necessarily, more in an example, longitudinal perhaps examination or somewhere or clinical trial. We might want to look at factors such as how one's perception of injury affects, say, the development of mental illness, of substance use. Of course, perception plays a big role in everything. You know, with the right attitude, it is said that people that engage in very risky behavior may have smaller consequences. So the way we think affects, of course, illness in general. So it's an important variable, yeah. But I don't have, and I can tell you as a psychologist, I can comment on what you're saying, but in terms of the survey study that we conducted, no, we're not looking at perception. No.
Have you looked for any differences in considering the expert?
I can't hear it.
Have you ever considered any ideas about looking for differences in cerebral level or in regions that may be affected in individuals who have been diagnosed with TBI versus control, and maybe like correlate that with certain aspects of perception, such as visual recognition or something like that?
I think I've heard some of the words of your question.
Okay.
Did you ask me whether we looked at, again, perception and cognition and looked at males versus females? Is that what you asked?
Sure.
Something along those lines. Okay, again, this is not a pure psychological study. This is a survey, right? And so perception, cognition. We asked, remember, those are self-reports, so we're asking them to comment on their behaviors and give us their perception, right, of how well fit they are or other things that might have something to do with psychological aspects, but no. That's your question.
Just if I can add, we are looking at some of those aspects, but in different projects. Not in the project that Dr. Ilie mentioned, but if you're interested in that, we are looking into that and doing some work around MRI and how the brain is perfused on MRI after a brain injury, or how the person recovers. So if that's an area of interest, we can talk about that later.
Sure.
Great, but Dr. Ilie wasn't, I think that's what he was getting, I could hear him a bit.
You were getting that.
Are most
Questions?
of your results based on the survey, or is it actually the clinical results from the cases that come to the emergency? And then how are you kind of comparing both results in ways to make changes or implement kind of diagnosis for TBIs?
All results were from the survey, exclusively. All results that were reported come from the actual survey, exclusively. No clinical trials. And the results capture hospitalization, but also non-hospitalization. That's what we're so excited about in a way, because we're asking them whether they spend at least, have you had a concussion whereby you lost consciousness for at least 5 minutes, or you were hospitalized at least one night because of symptoms associated with it. So it captures hospitalization, but also it captures the non-hospitalization data. What happens oftentimes is somebody in the audience said, you hit your head. You don't know what the doctor has said, because there is invisibility, and that's what we call it an epidemic. There is invisibility associated with the injury. You see, it's out of sight of it. How are you the next day? Well, kind of dizzy. I've got a little fatigue. I'm not sleeping very well, but hey, I just hit my head. It's going to go away. That's a misconception associated with the act of concussion. Most people, that's why we need more education around the issue, to raise awareness that it is a big issue. So much of what we think and what we do depends on the quality of our brain. Just as so much of our mobility depends on how our limbs are fine, right? And our physical strength and so on. So why would that be different for our brains? That's the question. And that's where we need to make the switch. There has to be a wake-up call that the brain is just very important, right? Given how much depends on it. Depends on it. Does that answer your question? Good. All right, thank you. Can we take one more question? Yes, okay.
Right. I'm just wondering, this kind of goes back to an earlier slide where you compared sort of differences of males and females with the stress levels associated with, et cetera. But I'm trying to untangle sort of, and you mentioned coping, so some of these mental health issues may be coping as a result of coping from injury, but I'm wondering if it's also coping from the functional impairments associated with a TBI. So conceivably, someone with a TBI could go out there and function completely normally. So I'm wondering if you've noticed any differences between sort of those who identify as with impairments functionally versus those who don't identify.
No, we haven't disentangled those. Again, I think a different type of study should be aimed at disentangling those two. And in fact, we have efforts underway that are planning to look at that.